Welcome to Engear. My name is Ramya Subramani and today we are going to see the importance of crisis communication. In healthcare, a crisis can take many forms. A sudden outbreak, a medical error, a system failure, or even a widespread public health concern. When these moments hit, our ability to communicate effectively becomes paramount. It's not just about delivering information, it's about fostering open communication, building trust, and ensuring everyone feels heard. Why is open communication so critical during a health crisis? First, it builds trust. In times of uncertainty, people crave honest, transparent information. When we communicate openly about what we know, we don't know, and the steps we are taking, we demonstrate integrity. This trust is the foundation for effective collaboration and patient cooperation. Secondly, it reduces anxiety and misinformation. A lack of misinformation breeds fear, speculation. By proactively sharing accurate and timely updates, we can combat the spread of rumors and reduce unnecessary panic. This means being accessible to patients, families, and staff and providing clear, concise answers to their questions. Thirdly, it facilitates effective decision making. Open communication allows for rapid sharing of critical information, enabling us to make informed decisions quickly. This includes internal communication between departments as well as an external communication with public health agencies and the media. So, how do we foster this open communication? Establish a clear communication plan. Before a crisis hits, we need to have a plan in place that outlines who communicates what, when, and how. Designate spokesperson, create communication channels, and ensures everyone knows their role. Prioritize empathy and active listening. During a crisis, people are often stressed and emotional. We need to listen actively to their concerns, acknowledge their feeling, and respond with empathy. Be transparent and honest even when the news is difficult. We must be honest and transparent. Avoid jargon, use clear language, and be prepared to answer tough questions. If we don't know sometimes or something, we must say so and commit to finding the answer. Utilize multiple communication channels like research out to different audiences through various channels, including internal emails, public announcements, and social media. Ensure accessibility for all regularly updates. Crisis situations are dynamic. Provide frequent updates to keep everyone informed of the last developments and the latest developments. In healthcare, our primary responsibility is to care for people. Open communication is not just a best practice, it is a fundamental part of providing that care. By fostering a culture of openness and transparency, we can navigate crisis effectively, protect our patients, and strengthen our community. Thank you and stay tuned with Engear for more videos.